from your head, okay?
Hey y'all, my name is Morgan Massa, and today I'm going to be doing a dressing change on my patient, Miss Smith. So first I'm going to check my doctor's orders and see what he has ordered me to do for my patient as to do with the dressing change on what type. So as I figure out what type, I'm then going to gather my supplies and go to my patient's room. I'm going to knock, introduce myself. Hey Miss Smith, my name is Morgan. I'm your student nurse today. Is that okay? She states, yes, that is fine. I'm going to provide privacy, perform hand hygiene, sanitize,
1, 2, 3.
gloves on. I'm going to talk to my patient and explain to her what's going on today. Miss Smith, are you having any pain on a level of 1 to 10? She states her pain level is a 1. If she was having any pain, I would then give her pain medication, come back in 15 to 30 minutes, and perform the procedure then. So I'm going to raise the bed to a good working height. I'm going to check my patient's wristband, making sure that it matches her name, date of birth, make sure it's the right patient. Miss Smith, today we're going to be changing your wound bandage. Is that okay? She states that is okay, and this is a good time.
Alrighty. Our next pillow, we're going to take.
And then next I'm going to remove this, exposing the wound. Miss Smith, I'm going to expose your wound, okay? Trying to keep her as covered as possible as well. So
I'm also going to place one blanket.
now I'm going to set up all of my supplies that are needed as my waist bag. Everything is in place, so now what I'm going to do is I'm going to begin to remove your bandage. Is that okay? She states that is okay. You want to pull back, trying not to cause any friction.
Roll back over. Then we're going to roll like this. Up from the blanket down. So first thing I'm going to do is remove those blankets from behind yourself.
And then going to remove the bandage and throw it away. At this time, I'm now going to place a waterproof pad under my patient's wound.
We're going to get ready to slide you back over. I got to place it back on your back, okay?
I'm then going to grab my solution. I'm going to lip it, making sure that it also is in date. If it hasn't been opened yet, I'm going to signature it, time, and date it. So it's been, hasn't been opened, so I did that. I'm going to lip it, getting some out, label to palm. That way, if you spill it, it won't ruin the label. So I pour some solution. I get some solution in my syringe. I take my basin and put it up underneath. That way, so when it runs off the wound or through the wound, it goes into the basin and doesn't get the bed too dirty. So once that is done, I'm then going to remove it. After that, also if the wound is packed, I would then remove it hand over hand until all the packing has come out. So once it is done, I'm going to remove my gloves because I have cleaned all the debris and stuff out. I'm going to put on a new pair of gloves, do new hygiene.
Prone position.
Yeah.
Alrighty. So now we're gonna turn the client back on supine position, and we're gonna try to move him up into the bed.
Alrighty, Miss.
Close the back. Now I'm going to, if needed, say the patient or the doctor states that he wanted the wound to be wiped with alcohol swabs. So I'm going to use my alcohol swab. I'm going to wipe outside, outside, inside. After that, I'm going to take my gauze and I'm just going to dab around the edges, trying to get like the rest of the moist from the solution, get it all. And then, say he wants a dry gauze, so I'm going to place a pad of gauze.
Count of 3. We're gonna grab this, and we're gonna move towards the bed. 1, 2, 3.
I'm going to get my tape ready.
His head does not bend. His body does not bend. Alrighty, Mr. Jones.
I done lost the other tape, but it's okay.
I guess we can lay him back down for purposes.
I'm going to get my tape ready.
Back situated, okay?
I also want to assess any kind of, like, if the drainage has changed any or got worse. I also want to measure the width, the depth, and the length of the wound as well. So now I'm gonna place the new bandage on top. I'm going to take my tape and let it just kind of fold to the skin, not pushing, let it fall.
Okay, right.
Do the same for the side.
Oh, that's if one was available. Like if you dropped
Again.
Okay, so when you start off, you tell them what you're doing, you access the facial stuff, right? You're removing the pillow,
And then
right? And then after you remove the pillow,
letting it again fall onto the skin. Once you're done, you're then going to remove your waterproof pad, dispose of it, perform hand hygiene,
that's what we're gonna put on the side, right?
it's gonna be a little side.
dispose of that. I'm going to cover my patient back up.
So then from the pillow,
Miss Smith, are you feeling okay? You're doing okay? She states she is good, not any pain. Okay, we're done. I'm going to lower your bed now. She states she doesn't need anything. At this time, I would perform hand hygiene again. I would make sure my patient is at the lowest position possible. All bed rails are up. Call light is within reach. She's comfortable. And then once I'm ready to go, I will go document my findings, how the wound looked, the length, width, depth, all of that. So making sure to document my findings, and then that's it.